initially, when there was the lockdown in March, it also created a lockdown for our students. Our students, not only did they have to leave the classroom and start to learn remotely, we have clinical education that goes on and lab education. So the students all of a sudden couldn't have that opportunity because the hospitals needed to focus on the patient and they couldn't have the students in there and feel like they could safely protect them. So initially our students, we had to figure out how can we teach our students about patient care when they're not at the bedside. So we've done all kinds of virtual things. It's amazing how many products came out, but also how our faculty had to rise up and think about how can we share experiences virtually so our students can continue to learn, because we had the other end of the spectrum where the hospitals were, struggling and needed the workforce. So we couldn't shut down nursing education. We needed to provide our students the education so they could continue to progress. So those first couple months were kind of tough, but then as the hospitals opened up more, our students have gotten back into the acute care settings and they've had the experiences. It's not quite 100%, but we're slowly getting there. What was surprising to me is how energizing this was for our students, because they saw those nurses in practice and they were inspired. They weren't afraid. I was afraid myself that we would lose students or students wouldn't want to come into the profession because they would see that it's not risk-free. And it's never been risk-free because any healthcare provider comes in contact with infectious disease all the time. But this was so real. So what we've seen, though, is the complete opposite. Our students have just been dying to get back into the healthcare settings and take care of those patients because they see themselves as someone that can provide the care that those patients need.